I'm considering it much more than I started in the week because I enjoy like sort of trying to help people with difficult situations. So like with depression, it seems much more rewarding.
I think you really get to see, because when you follow a doctor, it's really different from what you hear from other people, and then you really experience what a psychiatrist does, and you follow the whole team. So you experience it fully, like what it really is.
I didn't really know much about psychiatry at all, so it just seemed like a really good idea to find out more. There's just so much involved with psychiatry. Like, you could go in thinking you want to treat the patient in one way, and then having spoken to one or two people, you completely change your mind. You can go from one diagnosis to another. I mean, you've really got to work it out together, like look at details together and interpret it in different ways and come to one thing.
Kind of what I saw was that psychiatry is a lot wider range of things that you can do within it than I previously thought. I kind of thought it was one-on-one, like a person talking to another person, but through what we saw was mainly a group of people or a group of patients, and it was just different experiences for different applications of patients. I think I was based more on misconceptions about people with mental illnesses, like what they're like and who they are, and I think it's kind of opened my eyes to more the patients themselves.
I definitely consider it more than I did, because I came in having no idea really about what it was, but now it seems so interesting and like definitely worth pursuing.
Fantastic. Would you recommend the programme to other students, do you think?
Yes, definitely. It's so different to anything. I mean, work experience in general is so difficult to find, and from friends I've heard, like often you don't actually get to do much with your placement, and it seems almost like a waste of time because people are busy. But this is so structured, and I don't know, there's so much care and time involved in getting it organised, and it's just really, really good. It really gives you an insight.
Work experiences like this one are very important for actually deciding what you want to do with the rest of your life.
Sure.
I didn't realise there were so many different areas of psychiatry.
Yeah. I didn't realise how big a problem it was. Like, it's quite a few cases, and
it affects so many people in lots of different ways. I think I definitely tell my friends about it, because I don't think they know that much about mental illness like I didn't, so I think I definitely tell them all about it.
I kind of saw psychiatry and I thought, oh, I don't really know what that's about, and I've kind of heard things about it, but I really wanted to find out exactly what it might hold, and hopefully specialise in it when I study medicine. It kind of steered me a bit because it's sort of at the kind of forefront of medicine, I think, today, because there's so many kind of problems in the hospitals which could be sorted with if there was a psychiatrist there, and I don't think that in hospitals today, I think a lot of problems could be solved in a lot of time and money, so I think that's actually really prevalent in today's kind of medical. I think I've learned about that people with mental health illnesses, they aren't hopeless cases, and there's actually a lot of medicine available for them that isn't just with drugs. There's loads of therapy which I never thought even existed, so I think that's been really good for me to discover that.
Yeah.
Through this placement, which gives me an actual insight of that, like illness, like what the symptoms are, how they behave, what their appearance are like.
Before I kind of thought, oh, there's nothing that can really be done for people with mental health illnesses, and there's just so much stigma at the moment in the society, and what you hear in schools, and what people think mental health illnesses, and it kind of shapes the way you think. So it's been really good to meet people with mental health illnesses, and they're actually just some people normally functioning, and then some aren't.
They were a bit surprised because they thought that people with mental illness, the face will show that I have mental illness, or like they would look absolutely mad. But when I told them that they look normal, and they were quite shocked that I mentioned the word they look normal.
I haven't spoken to any of my friends yet, but I will do when I'm at school next week, and if I hear anybody kind of saying anything bad about people with mental illnesses, then I'll be there to correct them, definitely. Yeah, because it's so different to other areas of medicine and other work experience programs that you might be on. Because you really kind of, I didn't think you'd actually be able to meet the patients and stuff like that. But there's so much, you can actually go really in depth and sit in on consultations and possibly further than you'd be able to go with other areas of medicine. That's been really good.
Yeah.
For me, like, I would definitely recommend it because, like, I want my friends and obviously my family to understand that mental illness is not having a person being mad and absolutely weird, but they can be like normal people, and you can try to understand them and just treat them as a normal people, but not like as a absolutely different kind of species.
1 in 4 people can get a mental illness, and so just like the need to have extreme surgery or something is probably less likely than the need to speak to someone or a therapist or something about if you're depressed or something like that.
Yeah.
Like it's as a big problem, but just not as.
Also, the fact that it's quite treatable if you get
Yeah.
the right help. But then for some people, it's not. You're not able to treat it, and so it's really hard for them, and it impacts a lot on their life.
As a really practical work experience placement, like
You're right in the action, so you
Yeah.
get to see everything.
yeah, and you don't feel like a lost cause. Like you're just
Yeah.
sort of there not doing much. They do like your opinion and
Yeah.
stuff.
Fantastic.
Yeah, it's really good.
And do you think you might consider a career in psychiatry?
Yeah.
Oh,
I think so.
interesting.
Yeah, it's
And
been beneficial.
did you think that before the program as well, or is this kind of?
No, I didn't really know what to do.
Yeah, I was kind of interested in it, but
Yeah.
now I know a lot more about it, so I'm probably be more likely to
Yeah.
think about it.
Yeah.
Excellent.
Psychiatry is a lot more personal, and so psychiatrists find out a lot more about people's background and their whole family history and all their personal details, which a lot of other specialities don't tend to do.
Yeah.
Would you recommend the program to other students? Do you think?
Yeah,
Definitely.
Why would that be? What's the kind of reason behind that?
because you get to see so many different areas of psychiatry, and so it kind of opens your eyes to psychiatry, but also shows you what life is like in a hospital and on a ward and things.
Yeah.
Yeah.
Yeah. And as we said at the beginning, it was really hard to find it, but to find such an interesting
Work experience.
work.
So in some places you kind of sit there and you don't really do anything and you don't learn anything.
Yeah.
But from this I've
I've
definitely learned.
learned so much.